As stocks rally around the positive news of COVID-19 vaccine developments, medical professionals are sounding the alarm over the nation's plan to vaccinate especially vulnerable Americans like nursing home residents. Since the pandemic began in March, at least 67,000 Americans have died in nursing homes. Less than 1% of the country's population live in assisted living facilities. Yet the COVID tracking project estimates nursing homes may account for as much as 40% of the pandemic-related deaths. Now, healthcare workers are expressing anxious concerns over the vaccination plan for more than 1 million nursing home residents. One geriatric care specialist told CBS News MoneyWatch, quote, "The way the government has approached the vaccination distribution for nursing homes has been keeping me up at night." For more on this, I want to bring in the author of the article, Stephen Gandel. He is a CBS News MoneyWatch senior reporter. Stephen, welcome. Great to have you with us. So can you explain the wide range of concerns you found in your reporting?
Yes, so there are many, right? Number one, nursing home residents are not like the general population. They can't leave where they live to go to a pharmacy or go to a central location to get vaccinated. All of the vaccination specialists have to go to the place where they live. And there's around 60,000 nursing homes, assisted living care facilities, long-term care facilities in America. 60,000, right? And CBS is making progress. They said they've signed up 25,000, but there's still many more that have to be signed up and get into the distribution process. That's number one. The other thing is that nursing homes are not as large as, say, a hospital that opened its doors to a whole community, right? There's the average nursing home has 100 people in it, and there's no nursing home in America that has 1,000 people in it. Now, the reason this is a problem is because of the Pfizer vaccine, which is the first one out the door, which is the one that's most likely going to go to nursing care residents who are the most vulnerable. And the vaccine has to be at a negative 90 degrees, and so it's put in these shipping boxes, of which the minimum amount that can be shipped is 1,000. And the box itself can only be opened one time a day, or actually 2 times a day, for 180 seconds each time. So if you imagine going from one nursing home with the box, you open it up, you get all the stuff out, then you got to close the box, and you take the box to the next home, and it can't be opened till tomorrow. And you got to get those 1,000 doses out within 10 days, or the box spoils. It's all possible. It's all surmountable. But, you know, it's not an easy job, and it's making people nervous.
Absolutely. I mean, I can see how clear those concerns are. It seems to me like some changes have to take place on the distribution end. You know, as you just described, these cases, of vaccines that have 1,000 doses per case, can't they simply make cases that are smaller?
No, for the Pfizer vaccine, they have worked. Their engineers have come up with this specialized case. Remember, the Pfizer vaccine has to be kept while it's shipping at negative 90 degrees, 20 degrees colder than the South Pole in winter, right? So they've created these specialized cases where they all fit tightly in. There's these shells that slide in. It fits tightly in this box, surrounded by pelletized dry ice, and through the integrity of it, the minimum they could get was 1,000. It goes up to 5,000, but the minimum they get was 1,000. And that creates more difficulty, again, because nursing homes generally are not that big.
Right. And so what are your sources suggesting to address some of these issues?
Well, so my sources, and this came from the people in the industry, from the geriatric specialists, from the nursing care owners and operators, the big concern they have is that the government, to make it easier for the government, for the CDC, they contracted with CVS and with Walgreens to head the distribution and take charge of getting these vaccines out. But nursing homes generally have worked with a very specialized type of long-term care pharmacy. And those long-term care pharmacies already have contracts with every pharmacy, every nursing care home in America. And what the experts say is you need to bring more of them in, right? It was maybe a bad choice to put this all onto CVS and Walgreens. Now, CVS and Walgreens does combined, they do have some long-term care specialties, and they have contracts with a little over 3,000 nursing homes, right? But that's, again, with nursing homes and assisted living facilities, it's 60,000. So there's a lot of nursing care homes that are going to have to work with CVS if we continue with or Walgreens, if we continue with the current plan, who have no relationship with them. And yes, this is all possible. It's all surmountable. But the nursing care homes say it's making them more nervous. The geriatric specialists say it's making them more nervous because these are relationships that the nursing homes don't have. They don't have the relationships with CVS. They would have preferred to stay with their long-term care specialty pharmacies, which deliver 12, on average, 12 drugs per person a day. So they're in there a lot and know what they're doing.
I can see why it's making them nervous. It's making me nervous just hearing about it from you. So, of course, we have public health experts bracing for tremendous pressure on hospitals in the upcoming months and on the healthcare system in general. How do we ensure then that nursing home residents do not get left behind? I mean, if the logistics become so complicated for nursing homes, how do we ensure that people still stay focused on those deliveries that are so badly needed?
So number one, what I'm told is that right now, oddly, there's two plans for the nursing home residents and the nursing home workers, right? So the nursing home workers are not actually included in this CVS plan, even though they're going to be going to each nursing home. The nursing home workers have to go somewhere else to get vaccinated. So number one, what I've been told is that should be changed. The nursing home workers should be worked into the plan to make sure they're vaccinated at the place they are. And the second one, which is a problem with something else we haven't talked about, these vaccines have side effects. Not everyone gets it, but more people get side effects from these vaccines. 1 day of bad fever, muscle pain. Many more people are likely to get side effects from these vaccines. Now, you go in and you vaccinate an entire nursing care home, and you vaccinate all the staff on 1 day. Well, you're going to have a very tough next 48 hours, and many staff may not be able to come in. So what the experts I've talked about is which they haven't started yet, the CDC needs a robust database of what nursing homes are being vaccinated when, so the hospitals nearby can be ready to know, hey, you might be getting a whole bunch of elder Americans in with these types of symptoms. Be ready for it. Know what it is.
Wow, I'm glad we're starting to focus on this issue. It's so important, and it's coming down the pike before you know it. Stephen Gandel, thank you so much for joining us. We appreciate it.